Myth 1. Erectile dysfunction only affects older men. Let's bust this myth wide open. Erectile dysfunction, ED, is not just an issue for older men. While it's true that the likelihood of experiencing ED can increase with age, younger men are not immune. In fact, recent studies show that around 26% of men under the age of 40 experience ED to some degree. That's a significant number, proving that this isn't just a problem for the older generation. Various factors, including stress, anxiety, lifestyle choices, and health conditions, can contribute to ED in younger men. Believing that ED is solely an older man's problem can have serious consequences. Younger men who experience ED might feel embarrassed or think it's abnormal, preventing them from seeking the help they need. This misconception can lead to unnecessary stress and a decline in mental health, further exacerbating the problem. It's crucial for men of all ages to understand that ED is a common issue and that seeking medical advice early can help manage and treat the condition effectively. So, if you're a younger guy dealing with ED, don't let this myth stop you from getting the support you deserve. Subscribe to Brain Blitz for more health and wellness insights. Myth 2. Erectile dysfunction is always psychological. Let's clear this up. Erectile dysfunction, ED, isn't always just in your head. While psychological factors like stress, anxiety, and depression can certainly contribute to ED, there are many physical causes too. In fact, conditions like cardiovascular disease, diabetes, and hormonal imbalances are common culprits. Poor blood flow, nerve damage, and low testosterone levels can all lead to difficulties in getting or maintaining an erection. So, it's not just about your mental state, your physical health plays a big role as well. Believing that ED is purely psychological can prevent men from seeking the comprehensive care they need. Ignoring the physical aspects of ED means you might miss underlying health issues that need treatment. This is why it's crucial to get a medical evaluation if you're experiencing ED. A healthcare professional can identify any physical conditions contributing to the problem and recommend appropriate treatments. Remember, ED can be a sign of other health issues, so getting a proper diagnosis is key to tackling the problem effectively and improving your overall well-being. Myth 3. Only medications can treat erectile dysfunction. It's time to debunk the myth that popping a pill is the only way to treat erectile dysfunction, ED. While medications like Viagra and Cialis are well known and can be effective, they're not the only options out there. In fact, there are several other treatments that can help manage ED. Lifestyle changes, such as regular exercise, a balanced diet, quitting smoking, and reducing alcohol consumption, can significantly improve erectile function. These changes help improve blood flow, boost overall health, and reduce stress, all of which can positively impact ED. Therapy can also be a game changer, especially if psychological factors like anxiety or depression are contributing to the problem. Cognitive behavioral therapy, CBT, and counseling can help address these issues and improve sexual performance. Additionally, medical devices like vacuum erection devices, VEDs, and penile implants are available for those who need them. These alternatives highlight the importance of a holistic approach to treating ED. By considering both physical and psychological factors and exploring various treatment options, men can find a solution that works best for them. So, don't feel like you're stuck with just medication. There are plenty of ways to tackle ED effectively. Myth 4. Erectile dysfunction is just a part of aging. Let's tackle the myth that erectile dysfunction, ED, is an inevitable part of getting older. Sure, the risk of ED can increase with age, but that doesn't mean it's a guaranteed part of aging. Many older men maintain healthy sexual function well into their senior years. ED is not an unavoidable fate. It's often linked to other health issues that can be managed or prevented. Factors like heart disease, diabetes, and hypertension can contribute to ED, but these conditions can be controlled with the right lifestyle choices and medical care. The belief that ED is just something you have to accept as you age can prevent men from taking proactive steps to maintain their health. Regular checkups and a healthy lifestyle are crucial in preventing ED. Eating a balanced diet, staying active, managing stress, and avoiding smoking and excessive alcohol can all help keep ED at bay. If you're experiencing symptoms, don't just chalk it up to getting older, talk to your doctor. There are plenty of ways to treat and prevent ED, so take control of your health and don't let this myth stop you from enjoying a fulfilling sex life at any age. Myth 5. Porn causes erectile dysfunction. Let's clear up the confusion around the idea that watching porn causes erectile dysfunction, ED. It's a common belief, but the reality is a bit more nuanced. While excessive porn consumption can lead to issues like desensitization and unrealistic expectations about sex, it's not a direct cause of ED for most men. The key is moderation. Watching porn in moderation typically doesn't lead to ED. However, if it starts to interfere with your real-life sexual experiences or relationships, it might be time to take a step back and reassess your habits. Research on the relationship between porn use and ED is ongoing, but some studies suggest that there's no direct causal link. Instead, issues arise when porn consumption leads to changes in brain chemistry, affecting arousal and response to real-life sexual stimuli. This can happen if a person relies too heavily on porn for sexual satisfaction, leading to a disconnect in real-life intimacy. The takeaway here is the importance of moderation and maintaining healthy sexual habits. It's essential to ensure that porn doesn't replace or negatively impact your actual sexual relationships. Balancing your consumption and focusing on real-life connections can help maintain healthy sexual function. Myth 6. You can't have kids if you have erectile dysfunction. Let's bust the myth that erectile dysfunction, ED, means you can't have kids. ED and infertility are separate issues. While ED involves difficulty achieving or maintaining an erection, fertility is all about sperm health and the ability to conceive. You can have perfectly healthy sperm even if you're dealing with ED. So, if you're experiencing ED, it doesn't necessarily impact your ability to father children. It's a common misconception, but the two conditions don't always go hand in hand. There are plenty of treatments available for men who want to start a family despite having ED. Medications like Viagra can help achieve an erection, and other treatments such as vacuum erection devices or penile implants can also be effective. For those with persistent issues, assisted reproductive technologies like intrauterine insemination, IUI, or in vitro fertilization, IVF, can be options. So, if you're dealing with ED and worried about starting a family, there's hope. Talk to a healthcare professional to explore the best options for you, and remember, having ED doesn't mean you can't have children. It just means you might need a little extra help along the way. Myth 7. Erectile dysfunction means you're not attracted to your partner. Let's set the record straight. Erectile dysfunction, ED, does not mean you're not attracted to your partner. This is a common misconception that can create unnecessary stress and tension in relationships. The truth is, ED can be caused by a wide range of factors, both physical and psychological. Physical causes include health conditions like diabetes, heart disease, and hormonal imbalances. Psychological factors such as stress, anxiety, and depression can also play a significant role. So, if you're experiencing ED, it's likely due to a combination of these factors rather than a lack of attraction. It's crucial to communicate openly with your partner about ED. This helps avoid misunderstandings and ensures that both of you are on the same page. Encourage each other to seek professional help if needed. A healthcare professional can help diagnose the underlying cause and recommend appropriate treatments, whether it's medication, therapy, or lifestyle changes. Remember, ED is a common issue and addressing it together can strengthen your relationship. By being supportive and understanding, you and your partner can navigate this challenge and maintain a healthy, fulfilling relationship. Understanding ED and getting the right treatment can make a world of difference. Don't let misinformation hold you back. Take control of your health and talk to a healthcare professional if you're experiencing symptoms. It's all about taking proactive steps and staying informed. We want to hear from you. Which myth surprised you the most? Do you have any experiences or tips to share? Drop a comment below and join the conversation. Don't forget to subscribe to Brain Blitz for more health and wellness insights. We've got plenty of great content on the way. If you found this video helpful, please give it a thumbs up and share it with your friends who might benefit from this information. Thanks so much for watching. Your support means the world to us. And if you haven't seen it yet, check out our previous video on the top 10 fat-burning foods you should eat every day. It's packed with valuable tips to help you on your health journey. Stay tuned for more great videos, and we'll see you next time.